New year, new you. How's that for a resolution? Now, for the next couple of seconds here, we're going to talk about lipo. But I want you just to forget everything you think you know about lipo, because America's favorite dermatologist is here, Dr. Tess Mauricio, here today to talk about Tickle Lipo.
Right, forget the garden hose, right?
Well, that's the picture everybody has, this huge cannula that's the size of a garden hose that goes into your side and does this really intrusive, kind of gross procedure.
Right. Well, think about the size of a pen, tip of a pen. That's how precise the tools are now. And, you know, lipo, the benefits of lipo goes way beyond just looking good and, you know, vanity. We see it all the time. I've been performing lipo for many, many years now. And patients come in and they feel great. They're just happier because they've taken care of that a body part that just bugs them every time they look in the mirror, every time they go shopping, and you know, you take care of it once and for all, and it really gives patients a new start. So it's really perfect time to talk about it in the new year.
And is it true, you being the doctor here, you can settle this argument once and for all. Some people can go out and work out 23 hours out of a 24-hour day and eat right, and still their body composition is such that there's still going to be problem areas.
It's genetics. A lot of where we store fat, how our body looks, is really dictated by our genes. And, you know, I can take out 8 pounds of fat from someone's abdomen that they would have to lose 20 to 30 pounds to get rid of it. And then at
because
that
it's really true, when you're exercising, you cannot target the fat. I mean, your body is going to burn calories, and it burns so much muscle, so much fat.
You lose all the weight on your face. And actually, this is the Tickle Lipo technique, and there's a special nutational movement. This is Indio right there, and that's the cannula. You see, so tiny you can barely even see where the tip is, and
that's all that actually
that's happening
into the problem spot.
Exactly, that's it. We make a tiny little incision. We don't even suture it. You see how it's rotating. That's nutational movement, and it's gently shaking off the fat around it. And while doing that, it's preserving the fibrous tissue underneath the connective tissue, and so it's a lot gentle. And you get a lot less trauma than you used to. No more garden hoses.
These before and after shots are nothing short of amazing.
We're looking at a patient's back, female back, and you can just imagine how she used to be so frustrated with clothing. And this is just 1 week after, and you can see there's hardly any bruising, totally different silhouette. She's just so happy. She came back actually and had her abdomen done after, and that's
it worked so well that she said, okay.
That's what usually happens, because then you become a believer of the technique. You see how your life changes, and you know, it's not for patients like this who are, like you said, working out a lot but can't get that silhouette that they want, bothered by the genetics. Mom probably had the same saddlebag. I was the same. I had this procedure done as well on this area, hips,
You keep saying
thighs.
that, and I don't believe
It's
you. I want to see the before and afters the next time you come in.
Maybe. And so, you know, you just sculpt it easy, and we're able to do areas now that used to be very scary because of the large tools. Now with the smaller cannulas, we can sculpt it, the arms.
Much more delicate procedure. Now, again, as we look at these before and afters, they're so dramatic. Folks, though, they worry about taking the fat out and leaving loose skin. And you can kind of explain why with Tickle Lipo that's not a concern.
We actually are so surprised how much tightening patients get. We've done a number of patients now where we remove, like I said, 8 pounds of fat just on their abdomen. In the past, you'd think these patients would need a tummy tuck.
Right.
Pull that extra skin out. But no, nobody's really even complained of any loose skin. They're surprised. They're like, oh my God, it's tight. And that's really because we're able to now preserve the connective tissue under the skin with this super gentle procedure. And, you know, it's really allowing a whole population of patients who were scared to think about lipo without that big tummy tuck procedure. They can go for it.
You're offering this wonderful special. You'll do $1,000 off on the procedure for the chin
Yes,
This
now.
is a horrible area for a lot of people. And then buy one area and you'll give them what on the second area?
Most patients, if they have issues with their abdomen, they have issues with their love handles, so we'll take care of them both. They just pay for one area. It really allows us, we've offered this for the holiday, and it was so popular. We wanted to bring it back for the new year and give patients, you know, a chance to really take care of those problem areas once and for all.
So go see America's favorite dermatologist right up the road in Scripps Ranch, the Scripps Ranch Dermatology and Cosmetic Center, Dr. Tess Mauricio. Some great deals there. Buy one area, they'll do the other area, a second area, no extra charge, and $1,000 off on the chin,
yes.
which I'm looking in the mirror right now thinking, maybe.
Yeah, we'll see you at the clinic.
Okay, doctor, it's always great to see you. Okay, next time, before and afters, because I
promise you
skeptical.
I did.
Okay. For more information, go to san diego6.com.